This segment of Delmarva Life is brought to you by Delmarva Chiropractic.
When you get hurt or sick, of course, you usually seek medical attention. For example, if you break a bone, you're going to go see an orthopedic doctor. If you have a stomach problem, you go find a gastroenterologist to take care of that.
But what about problems deep inside your brain? Well, it sounds like something a neurologist or psychiatrist may address. Well, have you ever considered a chiropractor for these issues? Probably not, but you should.
As a chiropractor, Dr. Daniel Lane of Delmarva Chiropractic spends much of his day giving patients spinal adjustments or manipulating other joints to give them less pain and more mobility. But Dr. Lane doesn't just specialize in bones and muscles. He specializes in functional neurology, using a brain-based approach to managing a host of health conditions that are traditionally treated with drugs.
Traditionally, with neurology, we've looked at pathological processes or diseases and then use different therapeutic interventions from therein, typically pharmacologically based with medicines and things like that.
Dr. Lane says the brain responds to different stimuli, things like light, sound, touch, and pressure, just to name a few.
All of these things are affecting the brain at any given time, and they can be used to affect certain parts of the brain to increase the function overall.
In other words, addressing health problems by focusing on the part of the brain that controls certain systems of the body. Dr. Lane breaks his functional neurology patients into two categories: those who are diagnosed with a neurological disease and are put on medication.
Nothing's done to try and rehabilitate the brain, to give it the best fighting chance. It doesn't mean that you're going to reverse that disease per se, but give the person a better lifestyle.
The other group has a certain set of symptoms, but all of the conventional testing is negative.
These people have, again, issues with vision, headaches, nausea, what we call vertigo. They feel like as though they're spinning, and just don't feel well. Fatigue, depression, sometimes anxiety.
Dr. Lane says a diagnosis comes from patient history and a series of tests.
That diagnosis, based on those objective findings, can be made almost instantly. And because of the brain's ability to change and learn, what we call plasticity, what we would then do is test these areas that we're finding deficiencies in. So we would do some various therapies to them and see right away if they change.
Dr. Lane says treatments are based on whether or not they see those changes.
The treatments are very dynamic. They change almost weekly as the patient's brain changes. If you go to the gym and you hire a personal trainer, he or she will find certain muscles that are weaker than other ones, and they're going to work on those. I just do that with parts of the brain.
Most of the therapies involve the eyes.
The eyes are one of the greatest windows we have into brain health. And so by looking at function of the eyes, as well as other parts of the brain, you can very accurately determine areas that are working or not working or need some therapy.
And Dr. Lane says these therapies work.
I've seen people have entirely life-changing experiences within a month or two.
Changes, Dr. Lane says, are for the better without relying on medication.
And Dr. Lane uses functional neurology to treat patients with a variety of conditions, including attention deficit disorder, Parkinson's, and Alzheimer's. If you would like to learn more about functional neurology from Delmarva Chiropractic, go to our website, wdoc.com, click on our picture at the top of the page.
Functional neurology.
Right.
Makes so much sense. Well, it's not only humans who experience significant health problems. Sometimes our animals need medical attention as well. Up next, we're going to hear more about this year's concerning strain of dog flu, how you can help protect your family pet, and what role we may be playing in spreading the disease.
Well, maybe your dog doesn't have the flu, but he or she is simply dehydrated. When the temperatures soar, so could your pet's risk of falling ill. We'll learn how to keep our pets hydrated, healthy, and most of all, happy.
Plus, you're going to hear the story of one happy pup. This is Poe. How Poe is going on the ride of his life at the end of his life. More on his doggy bucket list a little later.
But first, you know Delmarva Life is all about community. That's your community too.
Is there something going on in your neighborhood? We'd love to hear about it, see some pictures from the event. Send us the information, well, along with any pictures you'd like to share.
You can reach us at comments@delmarvalife.com or like us on Facebook and share the info there. Delmarva Life, we'll be right back.